Hello, a warm welcome to you from SGT University. I am Dr. Shalini Upadhyay from Faculty of Medicine and Health Sciences. Today we will be discussing the topic of hepatitis A. Hepatitis viruses are those viruses which have predilection to cause infection in the liver. These are heterogeneous group of viruses that are hepatotrophic. They cause acute inflammation of the liver and they have identical histopathological lesions. Also, they have common clinical features which are fever, nausea, vomiting and jaundice. The classification includes hepatitis A, which causes infectious hepatitis, hepatitis B, which causes serum hepatitis, hepatitis C is non-A, non-B or transfusion hepatitis, hepatitis D is also known as delta agent, and hepatitis E is non-A, non-B enteric transmitted hepatitis. The route of transmission for hepatitis A and E is fecal-oral. For hepatitis B, C and D, the most common route is blood, followed by sexual and vertical transmission. Chronicity is maximum in hepatitis C and occasionally it may occur in hepatitis B. Oncogenicity is maximum in hepatitis C and hepatitis B. Now let's discuss hepatitis A in detail. The virus structure of hepatitis A includes an outer capsid, the genetic material as single-stranded RNA. It belongs to family Picornaviridae. The size of this virus is 27 nanometer and it is non-enveloped. It has an icosahedral symmetry with linear single-stranded RNA as genome, which is positive sense. It has only one serotype. Now, this virus is resistant to acid, heat, 60 degrees Celsius for 1 hour, ether, and it can remain viable for up to 1 month in dry state, and it can be preserved for years at -20 degrees Celsius. While it can be destroyed by autoclaving, boiling in water for 5 minutes, sterilizing through hot air oven, ultraviolet rays, formalin or chlorine with a concentration of 10 to 15 ppm for 30 minutes. The pathogenesis of hepatitis E includes entrance of the virus through mouth, then it replicates in the liver and it is present in the blood and feces for 10 to 12 days after infection. Its excretion can go up to 3 weeks after onset of symptoms. The mode of transmission of this virus are mainly fecal-oral, which includes foodborne as well as waterborne. Foodborne contamination occurs due to poor hygienic practices and waterborne contamination of the water system due to poor sanitation. Other modes of transmission include close physical contact, sex with infected persons like oral anal sex, illegal drug users, and people living in low endemic areas when they travel to high endemic areas without immunization. It can occur in both children, adolescents and adults. In case of children and adolescents, mostly the infection is subclinical in around 80 to 95% cases, but they excrete this virus in feces for longer time. Adults are more icteric, around 75 to 90% of the times, with higher mortality rate. The incubation period of hepatitis A is 15 to 45 days. There is no chronic or carrier state. there is complete recovery in more than 98% of cases. The clinical manifestations are relatively abrupt, that is subacute. There are two phases. One is pre-ecteric phase, where there are GI symptoms, and ecteric phase or jaundice, where there will be dark urine, yellowish sclera, and mucous membrane. Hepatitis A is a vaccine preventable disease that is transmitted either through person-to-person contact or contaminated food or water. Symptoms typically begin about 28 days after infection, but can show up as early as 15 days or as late as almost 50 days after exposure. The symptoms range from headache, loss of appetite, nausea, vomiting, abdominal discomfort, fatigue, joint pain, dark urine, clay-colored stool, and fever. Jaundice is yellowish discoloration of eyes and mucous membrane, which is the most common feature of hepatitis infection. The pathophysiology of hepatitis A virus includes an asymptomatic phase and a symptomatic infection. In children who are less than 6 years, more than 70% of the time it is asymptomatic infection, leading to spontaneous recovery. In more than 70% of the adults, the infection is symptomatic. But in the adults also, the infection recovery rate is more than 99%. In less than 10% of the cases, there will be extrahepatic complications, and even lesser than 1% will have acute liver failure that may lead to death or require liver transplantation.
Now let's discuss the various methods of diagnosing hepatitis A.
Coming to the lab diagnosis of hepatitis A virus, the methods of diagnosing hepatitis A virus include microscopy, culture, serology, and molecular tests. How can we detect the hepatitis A virus particle? The specimen that can be used are stool, liver biopsy material, bile, or blood. We can do a immunohistochemical staining of these samples and then visualize this through electron microscope. This is the only hepatitis virus where isolation has been attempted. It has been attempted in primary and secondary African green monkey kidney cells, fetal rhesus monkey kidney cells. It can replicate without cytopathic signs and apparent host cell damage. Due to absence of the cytopathic signs, we have to do immunoassay techniques to quantitate the infectivity of this virus. Next is serology or antibody detection. It can be done through immunochromatography, ELISA, radioimmunoassay, immunoblotting, and dot blot immunogold filtration techniques. So first is anti-hepatitis A virus total antibody detection. If that comes out to be negative, then there is no hepatitis A infection. If the test is positive, that means we have to follow it up with anti-HAV IgM antibody detection. If it is negative, that means it was a past infection or there is a previous vaccination history. If it is positive, that means the infection is acute. How do we interpret the serology result? If IgM is positive, that means the infection is acute. It peaks within 2 weeks after elevation of the liver enzymes and disappears within 3 to 6 months. While IgG will peak a week after IgM and persist for decades. So in this graph, we can visualize that IgM peaks first and a few days or week after IgM, IgG will peak and there will be sustained rise of IgG, while the IgM will peak in the icteric phase where there will be presence of symptom, jaundice especially, and elevation of the liver enzymes. It can be detected both in feces as well as in blood. Molecular tests detect the HAV RNA through reverse transcription PCR or antigen capture RT-PCR. The purpose of this test is to diagnose the acute infection or monitor response to therapy. There is no specific antiviral drug for hepatitis A virus cure. The treatment strategy include maintaining comfort of the patient, adequate nutritional balance, and replacement of the fluids which are lost due to diarrhea or vomiting. It is better to prevent such a disease. So the first thing we can do is hand washing, disposal of the infected fecal material by disinfecting it through 0.5% hypochlorite solution, purification of water by filtration and chlorination with a residual chlorine of 1 mg per liter, and use of boiled water during outbreaks, as we have already discussed that it can be killed by boiling for 5 minutes. There are two vaccines available for hepatitis A virus. One is formaldehyde inactivated vaccines, which is grown in human fetal lung fibroblast cell lines MRC5 and WI38. It is given to children more than 12 months of age, single dose, intramuscular dose in deltoid region. The booster is given after a gap of 6 to 12 months. It has a protective efficacy of 94%. Second is live attenuated vaccine. It is a single dose subcutaneous vaccine which is grown in H2 and LA1 strains and human diploid cell lines. Both these vaccines are highly immunogenic and they produce long-lasting immunity. Coming to human immunoglobulin use for hepatitis A, it is indicated for post-exposure prophylaxis of intimate contact. The dose is 0.02 ml per kg. It is protective for up to 1 to 2 months and it should be administered as early as possible. It is better to give it within the first 2 weeks. So the scenarios where it is not needed is if the person is already vaccinated, there was a casual contact like office, factory, school or hospitals, and if the person is elderly because they are likely to be immune.
So today we have discussed the topic of hepatitis A. Next time we meet, we will be discussing about other hepatitis viruses. Till then, keep learning, keep growing. See you next time.